Michigan's health landscape is shaped by a complex interplay of geographic, socioeconomic, and demographic factors. Understanding these elements through the five-level socio-ecological model reveals the unique aspects of the state and the disparities that arise. Michigan is characterized by its Great Lakes, vast forests, and a stark urban-rural divide. The state experiences cold winters and warm summers, influencing seasonal health issues such as respiratory diseases and vector-borne illnesses. Urban centers like Detroit and Grand Rapids face distinct health challenges compared to rural areas, including disparities in healthcare access, economic opportunities, and environmental exposures. Diversity is a hallmark of Michigan's population. African American communities are significant in Detroit, while the Southwest hosts a large Hispanic population, and Dearborn has a growing Middle Eastern community. Economic disparities are evident, with cities like Detroit and Flint experiencing high poverty rates due to deindustrialization. Education levels vary widely, impacting health literacy and access to resources that promote health. At the intrapersonal level, Michigan sees high rates of chronic diseases such as diabetes, hypertension, and obesity, particularly in minority communities. Mental health issues are prevalent, with significant disparities in access to mental health services. Interpersonal factors also play a critical role. Family structures and social networks differ across communities, affecting support systems for health management. Urban areas, especially Detroit, face higher rates of violence, contributing to trauma and long-term health issues. Organizational factors reveal significant disparities in healthcare access. Rural areas often lack sufficient healthcare facilities and providers, while urban centers may have more resources but face other barriers such as overcrowding and longer wait times. Community-level factors highlight the disparities in essential resources. Food deserts are common in both urban and rural settings, leading to poor nutrition and related health problems. Industrial pollution, notably in Flint and Detroit, has resulted in severe health crises, such as the Flint water crisis. At the societal level, state policies on healthcare, education, and welfare greatly impact health outcomes. Michigan's Medicaid expansion under the Affordable Care Act has improved access to care for many low-income residents. However, economic policies that fail to address unemployment and underemployment continue to contribute to health disparities. Cultural attitudes towards health and healthcare also vary, influencing health behaviors and the utilization of healthcare services. Specific health issues highlight these disparities. The Flint water crisis exposed severe public health inequities, with long-term health impacts from lead exposure. Infant mortality rates are higher among African American communities compared to white communities. Substance abuse, particularly opioid addiction, is a significant problem, especially in rural areas. By examining Michigan through the socio-ecological model, it becomes clear that addressing these disparities requires a multifaceted approach. From individual behavior changes to systemic policy reforms, a comprehensive strategy is essential for improving health outcomes across the state.